All right, so welcome to Quiver Ministries conference. I'm so excited to welcome everyone. We do it every year. At least this is my second time attending, second year in a row. I am Tokwe Mark Odige, and I'm excited to welcome everyone. Thank you all for coming. Thank you for committing yourself to growth. And I pray that the reason we've all gathered here will be justified. The lessons we want to learn, the knowledge we want to acquire, and who we desire to become. All the testimonies we are waiting will manifest and will be transformed positively from the knowledge we acquire from this conference. So special thanks to the convener and the visionary for Quiver Ministry, Mrs. Nike Abago. Thank you so much for what you do. Thank you so much for all you do. Thank you for your passion and your commitment to helping women on this journey towards fertility. We all know the reason why we have gathered. It is the reason we always gather, because we trust that the revelation that we need to achieve our desire would come from one word. All we need is one word from God through his vessel, and we pray that we'll get such word today. So once again, I want to welcome everyone to Quiver Fertility Conference, and I want to thank you for joining and paying attention and dedicating this time to investing in yourself and your journey towards fertility. My prayer is that God will answer us. He will meet us at the point of our needs and open the doors we desire for us. I already did a bit of introduction, being that I addressed the fact that fertility is the issue we always discuss when we gather at Quiverful. That's the theme, and that's the reason for this ministry's establishment. And I would like to invite the visionary of Quiverful Ministries to share with us and she's also the convener of this conference, the vision behind Quiverful Ministry, what informed this decision to put together this ministry to provide solutions for people. And before you go, I'd like to say congratulations on the babies that God has blessed this ministry with in the past 1 year. Between the last time we had this conference and now, we have 3 babies, right, Ma?
Yes.
To the glory of God.
4 actually. 4 babies.
4 babies. Awesome. Yes. 4 babies. So to the glory of God, we praise God for his beautiful gifts, and we expect that this year the Lord will add a 0 to that number. And
Amen.
it will be 40. It will be 40 Amen. Babies we're celebrating Amen. By the grace of God beyond that. So Ma, I'd like you to tell us the story behind how Quiverful came up and the reason for this conference. Thank you, Ma.
Thank you. Thank you very much. Let me start by saying thank you to all our speakers for the honor of their presence at our second annual conference. I'm so honored to have you, Dr. Olajuwon Alabi, Dr. Shittu Olawale, Pastor Ituah Ighodalo, and of course, the veteran actor, Silva. It's such an honor to have you all here. Thank you so much. Quiverful was born out of my personal struggle with infertility. We married in year 2000, and precisely January 29th, and yesterday marked our 21st years together. The struggle to conceive started after 1 year of active sex without pregnancy. By the 5th year, it was laid in my heart to start a fellowship for women in my category, but I was too timid and ashamed to yield for the fear of what people would say. Who would answer someone who has no proof of God's promises anyways? So I thought. So I kept trying to get pregnant as I thought. The fellowship will be accepted and embraced by women only if the leader has a testimony. After 10 futile attempts at IVF, I decided to do what God has laid on my heart. And so on the 17th of June, 2017, Quiverful was birthed. With a handful of people in attendance, to my surprise, people were very open to fellowshipping together. Even though the leader is equally trusting God. Barely 8 months into the ministry, the Lord blessed us with an adorable son through adoption. The purpose of the ministry is to support women spiritually, emotionally, and financially, helping those who want to explore medical options but can't afford it. Last year, we sponsored 11 couples for IVF treatment. However, out of 11, only 5 were able to proceed with the treatment. The others had issues around fibroid and could therefore not partake of the process, unfortunately. We're looking for doctors right now who would volunteer their skills pro bono to help these women, many of whom are already anemic as a result of irregular heavy flow. So we're going through the second phase of IVF as well this year. And the list of women waiting in line is so long. And this thing is really capital intensive, but we're trusting God to provide. The ministry was blessed with 4 babies last year from the IVF procedure. We thank God and our friends and partners who give from time to time to support the vision. A big God bless you also to Dr. Emeka Ikene of Olive Branch Clinic for his support through heavily discounted price and freedom to pay when able. Quiver is on a crusade to change the narratives around stigmatization and limitation and limiting mindset. It's not a crime to adopt or to have a surrogate carry your baby. No use pretending to be pregnant and showing up with babies you can't explain how you got. And it's okay to give testimony in church, confirming that you actually got pregnant through IVF. There is nothing wrong with it. And so I just want to say this morning that, I'm calling on people to support this vision and to also educate people, as many people as we come in contact with. This is a crusade that Quiver only cannot do. You have all these women around you. Be sensitive to them. Be sensitive to their predicament. It is not only, when there is infertility, it is not only the fault of the woman. It can also be as a result of low sperm count, as our doctors are going to enlighten us this morning. So on that note, I want to welcome everyone to this annual conference. And I pray in the name of Jesus Christ that everyone who comes with questions in their hearts, the questions will be answered in the name of Jesus. Thank you, everyone.
Amen.
Welcome.
Amen.
Thank you.
Thank you so much, Ma. Thank you, thank you, thank you. I cannot wait for the season when testimonies would boldly carry that they had the baby through adoption. They would come and thank God that God made the adoption process seamless.
Amen.
It would really be a huge one for all the churches to share such testimonies, because there's miracle in adoption, there's miracle in IVF, and there's miracle in every baby that God blesses us with, yes, through every means that God used to bless us. And I'm so happy to be able to be with this ministry to push that narrative over and over again. So I'd like to quickly go ahead and invite our first speaker. He's a doctor, and I'd like to read his profile quickly. Dr. Olajuwon Alabi. So Dr. Olajuwon Alabi is the CEO and Medical Director of South Shore Women's and Children's Hospital. He's a specialist obstetrician and gynecologist and a member of the Royal College of Obstetrician and Gynecologists in the United Kingdom. He is an expert in advanced gynecology, gynecological endoscopy surgery, that's minimal invasive surgery, and one of the leading experts in the field in Nigeria. His other areas of interest are fibroid treatment, infertility and assisted reproductive techniques, endometric diagnosis and treatment, high-risk pregnancy care, and recurrent miscarriage. He obtained his MBBS from the University of Ilorin in 2008 and also had a postgraduate diploma in family medicine. Okay, I think I'm jumping to another person's profile. So please help me to welcome Dr. Olajuwon Alabi, the CEO and Medical Director of South Shore Women's and Children's Hospital. Thank you, sir, for joining us. Thank you for your wisdom. You have the floor to take us through your first presentation before we have the question.
Okay, thank you. Thank you very much. Thank God you quickly realized that I'm not from Ilorin, and I went to medical school in Ogun State. So thank you very much. Thank you for inviting me to give it to talk about fertility treatment today. About fertility today. Thank you, Mrs. Abago. I'm really impressed about all this, and we probably will be very happy to talk about this even after, in terms of partnership and things like that. So without wasting time, I know I have a very limited time, and talking about fertility issues can take a long time. So my aim is to talk about what causes fertility issues. And there are lots of things, but I think I have 15 minutes, so I'm going to try to summarize it. Now, like you rightly said, fertility means that a couple that have been living together and having unprotected sex quite frequently within a week. And if initially it used to be the set time used to be 1 year, but now for different reasons it's been moved to 2 years, just to give people a chance, because it's been noted that we're very fertile in different ways, and by leaving couples alone, a lot of them will get pregnant within 2 years rather than 1 year. By the time you put 1 year, you'll start rushing people into IVF. So let's look at 2 years. A couple that have been living together and have not been able to achieve pregnancy for 2 years. So what happened? The first thing is that they have to go to their doctor to have, I think in Nigeria, things can be a bit different. People come to you before they even get married. Oh, doctor, can you just check me? When I get married, I just don't want to find any problem. But a lot of people will come when they're actually married. The different reason, like you said earlier as well, fertility is not only related, or infertility causes is not, sorry, I don't want to use infertility. I'm going to use fertility issues, and I'm going to use some fertility. So contrary to what people think that is a woman's problem, it's a couple's problem. It's not only a woman's problem, because we know that 50% of the time it will be the male issue, and then 50% of the time it will be a woman's issue. So I'm going to focus on, I'll talk about the male issue, but I won't go into details. Yes, men can have sperm issues. It might be that they are not producing any. Why are they not going to produce any? Sometimes some men are born with a blockage somewhere in their tube that takes sperm from where it's formed to the penis, and it doesn't let the sperm come out. So in things like that, there are things we can do to find out whether that's the case and talk about options to manage them. Sometimes it's acquired. Sometimes some people might have had infection, things like chlamydia, gonorrhea in the past, and it's caused like blockage, and it doesn't let the sperm. They're producing the sperm, but it's not coming out. But sometimes, majority of the time, it's not like that. It's just because for different reasons, they're not producing enough sperm, or whether there's motility issue, the sperm are just not moving as much as they should move. When we produce sperm, a lot of the sperm that humans produce, a lot of them are abnormal. The way I explain this is that sperm is the high production, or where sperm are produced in a high production industry, where things are churned out at extremely fast rates. So because of that, a lot of the sperm are not formed properly. So majority of sperm are abnormal. The normal ones are very limited. But sometime in that organization, the company might be producing more of the abnormal rather than the normal. So we need to look at that as well. And sometimes it's just an infection. I know in this part of the world, they treat infection all the time. A lot of infection are not really infection. But by the time you're seeing a man, oh, I've been treated for an infection because my sperm is low. But the main thing is that men can have fertility issues as well. And like I said, 50% of the cases. So let's go to the woman. In this part of the world, there's so many reasons that women have fertility issues. Sometimes fertility or infertility can be unexplained. You can investigate the couple, husband and wife, and you don't find anything. Sometimes with things like that, you just need to reassure them to say, you know what, if you're not in a rush, just take time, because I'm sure you've heard people say, oh, I didn't get pregnant for 5 years and then it happens. And they will also tell you that once it starts happening, it just continues to happen. God is the controller of our body. I know that he doesn't want to make us unhappy, but he's the only one that can explain that, why people will not be able to get pregnant for 10 years and suddenly they'll start getting pregnant. So going to the cause of the one that you can find, I think the first thing I'll talk about, since Mrs. Habago has mentioned it, in this part of the world, fibroid is a big issue. I know that sometimes when you're in discussion with doctors, they will say, oh, fibroid doesn't cause fertility. And so it depends on the type of fibroid. I think we're so endemic with fibroid in this part of the world that yes, fibroid can cause fertility. Especially the extremely large ones and the ones sitting where the babies should normally sit at. So I think it's always important to have a scan and then speak with somebody that knows what they're doing about that. But it's important to find out that this fibroid can definitely affect my fertility, because not all fibroids can affect fertility. Some of them don't. And one of the major problems as well is that if a fibroid surgery is not done properly, it can cause fertility issues as well. So a lot of people are a bit confused. They've been told that, oh, your fibroid can cause fertility. And then you're telling them as well that, well, the surgery for this fibroid can cause more further fertility issue. So they get it confused and about making decisions about what to do. I mean, there are so many options in treating fibroid nowadays, and the main thing is going to a specialist to know how to, that knows how to do that without it compromising your fertility. Some hormonal issues as well. There's a one called polycystic ovary, where you're not producing as many eggs as you should. And that is an inborn thing. People are born with it. How do people know they have it? Some people are overweight, they have facial hair, they have hair in different part of the body. It's just a mismatch in, I don't want to go into science that much. It's your body, something affecting the way your ovaries produce eggs. So yes, you can still produce eggs, but not as frequent. And there are things that can be done to prevent that as well. The other part is damaged tubes, fallopian tubes. Fallopian tubes are the structure that takes eggs from your ovary and bring it to the womb to meet the sperm. For different reasons, the fallopian tube can be damaged, either from a sexually transmitted infection or from a infection from surgery that you did, or from conditions like endometriosis, where it's a gynecological problem like fibroid, or so many other things. It just shows that the tube is blocked. So there's no pathway for the egg to meet the sperm. Now, there are tests that can be done by your doctor to find whether that is the reason, and also find whether it can be treated, or whether, I mean, interestingly, 1976, when the first IVF was done, that was the reason IVF was done in the first place. There was a woman who had damaged tubes and they wanted to get her pregnant. And so they bypassed the tube. They went to pick the eggs, join it with the sperm, and put it back inside the womb so that it becomes a baby. So damaged tubes can do that as well. Now let's go to the womb. One of the things I see a lot here in this part of the world is a condition called Asherman's, which is addition inside the womb. Now, unfortunately, because a lot of people, when they get pregnant and wants to terminate the pregnancy, they go to quacks. So the quacks puts things inside their womb and then damage the inside of the womb and allows and prevents. So this leads to problem in the future, because the womb is meant to be like a container. So when there are damages inside it does that. So there's no space inside. The advice I give to people is that when I want to believe that you shouldn't have sex outside marriage, but if it happens, I think it's important you speak with an expert or go to a good hospital if you want options about your care, so that you don't go and start patronizing people that will damage you forever. I mean, I see so many young women that unfortunately their womb has been damaged even before they got married. So I think that is important as well. Then we have people that sometimes they have structures inside their womb that they are born with. Like I said as well, the womb is a container, and sometimes it's meant, or most times it's meant to be like that. It's one part, and this part forming. So this part in the middle is meant to disappear to form a container, but sometimes it stays there. And then people struggle to get pregnant or to or continue to have miscarriages until that's discovered. And if that is discovered, it needs to be treated. That's called uterine abnormality, which sometimes is not very common, but it's important that we investigate that and look for that as well. Now, things like eating, not eating properly, overweight, underweight, smoking cigarettes, smoking weed, all of that contribute to fertility issues as well. Or you're just working or not having enough or adequate sex. Or, I mean, it's surprising that sometime as well, some people start having intercourse, and unfortunately, they don't know what they've never experienced. You know, a virgin woman and a virgin man comes together. Sometimes you'll be surprised what we get in the clinic. Sometimes they're not even having penetrative sex, and they feel that they are. So when the people come to the hospital, it's important we take a very good history to know exactly what they're doing well and what they're doing wrongly, and to allow us to manage them accurately. So I think in short, I've kind of mentioned the main reason why people have fertility issue. I mentioned the tube issue. I mentioned the womb issue, which is fibroid, adenomyosis, Asherman's. I mentioned the not producing enough eggs. Now, okay, the other thing I forgot to mention is that as the world advances, women are now more into working, they work a lot more than they used to do. So people are career focused, and sometimes because of careers, there's something called fertility age, because as you grow older, your eggs become to get reduced. By the time you get to about 36, 37, you're getting to the place where, when they say biological clock, by the time you get to 38, 39, most of your eggs are almost disappearing. And that is why you start struggling at that age to get pregnant. I'm not saying that you can't get pregnant above that, but the chances become a lot slimmer. So age is a contributor to fertility issues as well, especially people that marry late. So they start having difficulty in getting pregnant because of that. Those are the main reason, really. I think I've kind of touched on I didn't want to go into too much scientific detail. I want to make it as a conversation as possible. So those are the issues that I would like to address as the common cause of fertility in our women. Unfortunately, a lot of people have sexually transmitted disease and they don't know, because in women, sometimes it doesn't show up, but in men it shows up. So it allows men to treat themselves. In women, it doesn't show up. It just goes inside and gradually damages particularly the fallopian tubes. And by the time you're ready to get pregnant, you just notice that it's not happening. You do the test called HSG and it shows that the tubes are blocked. You can't really explain why it's blocked, but that's the reason most of the time. So I think it's important that I know that we don't like to talk about this, but it's important that we start educating our young girls either to abstain from having premarital sex. But even if it's going to happen, I think it's important we start talking about safe sex as well in terms of condom and stuff like that. So I've been told that I have 15 minutes. I think I've used 15 minutes, and I will be waiting in the when we go to the question and answer session. Thank you very much. Hello?
Yes, we heard you. Thank you very much, sir.
Okay, thank you.
So that was pretty enlightening. I really wish we could get more people to listen to this, especially when it is at the preventive stage where we can avoid most of these things happening. It is important we get more information out concerning these things. Thank you. I know there will be lots of questions, and I'll be willing to take the questions. Kindly put the questions in the comments. We have a few questions already, but I would like to invite the next speaker, who would be giving us more information concerning infertility. That's the second speaker is Dr. Olawale Shittu. I was already reading his profile earlier before I realized that, oh, this is Dr. Shittu, is a different person entirely. So Dr. Shittu, let me introduce you officially. Oh, Doctor, please, I hope you're reading, Dr. Alabi, I hope you're reading the comments, because people really, really enjoy your comments, and they're right there within the Zoom, right here within Zoom. You see the comments, people really enjoyed it. So Dr. Shittu obtained his MBBS from University of Ilorin in 2008, and also has a postgraduate diploma in family medicine from the National Postgraduate Medical College of Nigeria. His special interest is in fertility and reproductive health, which led him to work at Bridge Clinic and currently with Bloom Fertility Clinic. He has gathered significant experience in the management of couples with infertility in the last few years. He's a member of the European Society of Human Reproduction and Embryology, as well as the Association for Fertility and Reproductive Health Nigeria. Please, Doctor, I want us to give a Zoom round of applause. There's the way we do it in Zoom. Just clap, clap, clap through the Zoom platform for Dr. Shittu as it takes the stage. Dr. Shittu would like to hear from you.
Okay, good morning, everyone. And I'm Dr. Shittu Olawale. I'm a fertility physician, and it's an honor to have been given this opportunity by Quiver Ministry to talk about demystifying fertility treatment options. Because, like Dr. Alabi mentioned, this is something we do not talk about as much as we need to, especially in our part of the world. And we all know that reproduction is one of the key elements of life. An inability to achieve that purpose can lead to lifelong mental and physical health issues in people. So it is important that we keep having this kind of narrative so that we enlighten ourselves. I know there are a lot of information, misconception, myths that people have either heard from maybe colleagues, family, friends, just well-meaning people just want to like, what's going on? You guys are not taking it. Okay, do this, do that. A lot of time they want to do good, but in the long run, sometimes they cause harm than they do good. So what I'm going to try to do, just like the Alabi did earlier, is to give as much information in the limited time that I have, so that at the end of this discussion, as many people as possible listening will be able to know what to do and when to do and what steps to take, so that they get the right thing to do. Like Dr. Alabi mentioned, when talking about infertility, we like to define it as the inability of a couple to achieve a pregnancy within a time frame, despite adequate sexual exposure, unprotected sexual exposure. Now, when we talk about adequacy, adequacy basically just means that, okay, the couple are having at least sexual intercourse 2 to 3 times in a week, because studies have shown that couples who have sexual intercourse 2 to 3 times in a week, 60% of them are able to achieve a pregnancy within 6 months. And 80% will achieve a pregnancy within 12 months, and in about 18 months, 90% of couples would achieve a pregnancy when having adequate sexual intercourse. Now, unprotected sexual intercourse means there is no use of condom in the man, and then the woman is not using any other form of contraceptions like the pills, the injectables, or IUCD as well. I would also like to talk about the importance of age in fertility terms, because the woman is born with a fixed number of eggs, and as she advances in age, the quality and the quantity of these eggs keep reducing. In the 20s and early 30s, which is the peak fertility period for women, most women, the chances of them achieving a pregnancy is between 25 to 40%. And by the time the woman gets to 40 years, the chances of achieving a pregnancy will have dropped to about 5 5%, which is because as human ages, the quality of the eggs unfortunately depletes. Most women are born with between 1 to 2 million eggs at birth, and by the time they get to puberty and start menstruating, that will have dropped to between 400 to 600,000. And every month that the woman has a cycle, a certain number of eggs starts that process, but only one reaches maturity and is released at ovulation. So when a pregnancy doesn't happen and the woman sees a period, what that means is she has lost a certain number of eggs. And like I mentioned earlier, unfortunately, it's the good eggs that go first. So it is important for us to have at the back of our mind that age is important when talking about fertility in women. And that's why when a woman is less than 35, okay, we are not so aggressive about treating. But the moment the woman is above 35 and she's been trying for, let's say, 6 months, we advise that, okay, after 6 months, pregnancy is not happening, she should go to a center where she can be properly evaluated and advised on the next line of action to do. I would also like to just add a little on what causes infertility in men and women, and then I'll talk about investigations and possible line of treatment as well. I hope I'm able to cover all this before the 15 minutes is up. Now, for normal conception to happen, when a woman ovulates, an egg is released from the ovary, which is picked up by the tube and travels inside the tube to about midway. Sperm that is released within the vagina swims up through the womb, goes into the tube and meets with the egg inside the tube. The sperm and the egg now binds together, which is what we call fertilization. This fertilized egg now starts moving and growing. Then by the 5th day, it migrates back into the womb and attaches into the innermost part of the womb that we call the endometrium. It implants. This attachment or implantation is very, very important, because if it doesn't happen, that pregnancy or that baby will not grow because it doesn't get support from the mother. Now, looking at this scenario, it is safe to say that, okay, what would be the issues if the couple has been trying to achieve a pregnancy and is not happening? The first thing we want to look at are the ovaries. Is egg actually being released when the woman ovulates? Because if there is no egg, there is nothing for the sperm to fertilize and pregnancy will not happen. And what are the things that could affect the ovaries and egg release? Like Dr. Alabi mentioned earlier, 1, the age of the woman. 2, is there any form of hormonal imbalance like polycystic ovarian syndrome that is making it difficult for eggs to be released? Then also things like endometriosis also can have an impact on egg being released. So those are some of the things that could have an impact on the ovaries. Then the next thing we want to look at are the fallopian tubes. Remember I mentioned that it's only inside the fallopian tube in the woman that the sperm and the egg can meet for pregnancy, for fertilization to happen and pregnancy to eventually happen. So if the tubes are blocked and not functioning properly, that also can have an impact on pregnancy happening. And Dr. Alabi also has mentioned some of the causes of tubal blockage. Then the next thing we look at in the woman is that innermost lining of the womb itself, the endometrium. Is there anything sitting inside it or distorting or pushing, distorting, making it difficult for either sperm to swim through and go into the tube to meet with an egg, or making it difficult for an embryo to come and attach an implant? And Dr. Alabi has already mentioned some of the things that could affect the womb, so I won't go into that. Then the final thing we look at in that scenario is the sperm itself in the man, the quality of the sperm. And when we look at the quality of the sperm, we are looking at 3 parameters. 1 is the count of the sperm. 2 is the morphology, the structure of the sperm looks. And 3 is the motility, the ability of the sperm to move. Now, these 3 things are important because when sperm is ejaculated within the vagina, it needs to travel all the way to the tube to meet the egg. And in doing, and the lifespan for sperm is between 2 to 3 days. So in traveling from the vagina to get to the tube, a large number of the sperm cells will die off. But the higher the count, the higher the chances that some of the sperm will make it to the tube and one will meet with the egg and eventually fertilize an egg. So that is why the count is important. Now, motility, the sperm must be able to move very rapidly and very fast to make it to the tube before they die off, which is where the motility becomes important. Now, talking about the morphology, the sperm must have a head, and a tail. The head is what breaks off to fertilize the egg, while the tail is what is responsible for the sperm moving. So if you have sperm cells without head, there's an issue, or without tail, there's an issue as well. Dr. Alabi has already helped on some of the causes, some of the things that could have an impact on the quality of the sperm. So from this narrative, it is obvious that that misconception that when a couple are having difficulty achieving a pregnancy, that the problem is from the woman is an absolute myth, because it can be from the man, it can be from the woman, and in some cases it's a combination from the man and the woman as well. So the most important thing is if a couple is having difficulty achieving a pregnancy, they should go to a center where they can be properly evaluated to be sure if it is an issue coming from the woman or if it's an issue coming from the man as well. Now, looking at what are the investigations that are done to assess fertility in a couple. The first thing is when the woman comes in, blood tests are done. This blood test looks at one, hormones that have an impact on pregnancy, like thyroid stimulating hormone, prolactin level. Then also with the hormonal test, we can have an idea of the reserve of the egg of the woman, so that this woman can be advised appropriately. Remember, we mentioned that as the woman advances in age, the quality and the quantity of the eggs keep reducing. So it's imperative that we have an idea of what the reserve is. And because we said, okay, the reserve usually gets depleted above 40, doesn't mean that someone less than 40 and not have the reserve depleted. There is something called premature ovarian failure. So it is important that if a couple has been trying 1 year, 2 years, pregnancy is not happening, they should go to a center where they can be properly assessed. Now, the next thing to be done in the woman to assess fertility is something called an HSG, which is used to assess the fallopian tubes to see if they are open or blocked. Because remember, I mentioned it is only inside the tube that the sperm and the egg can meet for fertilization to happen. So it's important that we're able to assess that as well. And then the final thing we do in the woman is to assess the lining of the womb, which we do with a transvaginal scan. Now, during this scan, also, we can look at the ovaries as well. And inside the ovaries are what we call follicles. Inside the follicles are where the eggs are. So when we do the scan and we look at the ovary, we count the number of the follicles that we can see as well, because that also gives us an idea of the reserve of the egg of the woman, which will marry with the blood test, the blood hormonal test that we have already done. And sometimes the transvaginal scan alone might not be adequate to help us assess the lining of the womb, and we might need to do some further advanced testing, like doing something called an hysteroscopy or a laparoscopy. Now, in case you are wondering why that, the analogy I like to use to explain that is, let's assume you have a car with a tinted glass, and you expect that if you look through the glass into the car to see a man in the driver's seat, but you are now looking through that tinted glass, you are not sure if you are seeing a man or if he's even sitting in the driver's seat or not. You know, for you to answer those questions, you need to do either of three things. Either you remove the tint, you roll down the glass, or you open the car door. So the scan that is done, the transvaginal scan, is like you are looking through the tinted glass. So if you are not totally sure what you are saying, without go a step further and say, okay, let's do something like an hysteroscopy, which is like you are opening up the car door. The hysteroscopy basically means you have a tube with a camera attached at the tip, which is attached to a screen, which is passed through the vagina to look at the inner lining of the womb. Now, those are the investigations that are important to be done for the woman. Now, for the man, the test to be done is what is called seminal fluid analysis. There is also this misconception by men that once I can ejaculate and I see that white fluid coming out, I have sperm, but that is semen. You can't see sperm with your ordinary eyes. They are microscopic structures that you can only see under the microscope. They are tiny tadpole-like structures. So, this, what the semen does is to protect the sperm and support it and help it in moving through, navigating through the vagina, the womb to get to the tube. Now, the sperm is produced in the testes. There are certain tubes that carry the sperm away from the testes and takes it to the through the pathway. Is now mixed with semen along the way. When the man ejaculates, sperm and semen comes out together. So sometimes there could be an issue with production of sperm in the testes. could be a blockage along that tube. So a man might be ejaculating, but there's no sperm in that ejaculate at all. So it is imperative that in analyzing a man, that seminal fluid is analyzed to be sure that, okay, is there sperm in it or not? Because that will not guide us and say, okay, this is the cause of infertility and this is the thing to be done. Now, the next thing I'll try to talk about the possible treatment available for couples who have been trying to achieve a pregnancy. There is this misconception as well that once a couple has issues getting pregnant, the only treatment is IVF. No, that is totally wrong. The treatment for couples who are having difficulty achieving pregnancy varies. It depends on what the cause of the infertility is. That determines what treatment is given or is a couple are told to go through. Now, for some people. Okay, so I was talking about the possible treatment available for couples who are having difficulty achieving a pregnancy, and there is that misconception that the only treatment available for couples having difficulty is IVF. No, that is not true. There are various treatments available, and treatments are prescribed to the couple depending on what the cause of the issue is, the infertility is. For some people, it's just lifestyle changes that they need to achieve a pregnancy. And like Dr. Alabi mentioned earlier, there are some acquired causes like smoking, drinking, being overweight, being underweight, and in those people, all we need to do is tell them stop drinking, stop smoking, try to add weight or lose some weight. Even not having adequate amount of sleep can have an impact on fertility in a woman. Ideally, we should have between 6 to 9 hours of sleep. Less than 6 hours can have an impact on the fertility in a woman because it can affect the hormones that regulate that process. Having more than 9 hours also could have an impact on it. Now, in some people, when we do this investigation, we realize that, okay, what the issue is, they might need advanced treatment, like what we call an intrauterine insemination, which basically just means that we are taking sperm, the woman is, the couple, we observe them, and when the woman is about to ovulate, we tell the couple to come into the clinic. The man gives us a sperm sample, which we prepare and inseminate or push into the womb of the woman. And the reason why this treatment is done is in some women, the cervix, which is the neck of the womb, might not be conducive for sperm to flow in freely. And sometimes because of issues with the sperm, when we do the analysis, we realize that, okay, they don't have the ability or the strength on their own to make it all the way to the tubes to meet with the egg. So what we do in insemination is we are pushing the sperm into the womb. And by so doing, we are achieving two things. One, if there are any issues around the neck of the womb, we are bypassing that because we are pushing the sperm into the womb. And by pushing the sperm deep into the womb, we have shortened the distance that the sperm needs to travel to get to the fallopian tubes. And for some couple, the treatment might be that, okay, maybe because there is a blockage in the tube. Now, if that happens, the sperm and the egg cannot meet. And for a pregnancy to happen, the sperm and the egg can meet. This particular scenario is one that, okay, we tell the couple IVF is the way to go. Because what we do in that scenario is we collect the eggs from the woman, we get the sperm from the man, and what is supposed to happen inside the fallopian tube, we do outside in the laboratory, inject the sperm into the egg, and when they fertilize, we allow them, we leave them in what we call incubators. These incubators have been designed to function like the fallopian tubes, and when we have the embryos that develop, we transfer the embryo into the womb of the woman and hope that pregnancy happens. As part of treatment as well, we have donor treatment cycle. Now, what donor treatment cycle means is we have assessed the woman and we realize that, okay, the reserve of the egg is completely gone, meaning that she doesn't have eggs anymore, but she still wants to be a mother. So what we do is we get eggs from another person, a younger person with quality eggs that we call a donor. We inject those eggs with the husband's sperm, and when we have the embryo, we transfer the embryo into the womb of the woman, and she carries the pregnancy and delivers the baby. Now, we can also do a donor treatment for a couple where the man doesn't have sperm at all. And we have tried to get sperm from the testis, we are not able to. In that scenario, what we do is we get the egg from the woman, use the sperm from the donor, inject it into the egg. When we have the embryo, we transfer the embryo into the womb of the woman. And also, as part of advanced treatment, there is something called surrogacy. In this scenario, what it means is the woman, after investigation, after investigation, we find out that, okay, either for one reason or the other, she has a medical condition and carrying a pregnancy will pose a risk to her life, but she has had a surgery or issues with the womb and the womb has been taken out. In that scenario, the woman doesn't have a womb to carry a pregnancy. So what we do is we get her eggs, get the husband's sperm. When we have the embryo, we transfer that embryo into another woman who is just, in quote, a vessel to carry the pregnancy for them and deliver the baby as well. So I know my time is almost up. So what I'm going to say is, if you don't take anything away from this conversation, take three things away. One is that causes of infertility could either be from the man and the woman. That's one. Two, there are different treatment options available depending on what the cause of the infertility is. But the most important is you have been assessed so that a treatment can be prescribed to suit you because of the problem that you have. And also, don't think there is no light at the end of the tunnel. There is a light at the end of the tunnel. I want to encourage everybody listening today that all you have to do is take that first step and see a specialist who would assess so that you can be advised on the next line of action to take. May God be with all of us, and thank you all for listening.
Thank you.
So thank you so much, sir. Thank you, Dr. Shittu. That was very informative, very, very scientific and detailed. But I think that information is what we need more than ever in this, when we find ourselves in this situation. I really appreciate you. Please give Dr. Shittu a warm round of applause. Appreciate him for his information. Our next speaker is a very well-known person. She's a mommy to many in the media space, and she's not a stranger to us all. So I'd like to officially read the profile of Auntie Joke Silva, MFR. So Joke Silva, MFR, is a Nigerian actor, director, and businesswoman. The veteran actor is a graduate of the University of Lagos and the Webber Douglas Academy of Dramatic Arts in London. She began her career in film in the early 90s. Ajoke Silva is a co-founder of Lufudo, producers of artistic content, and Lapa, where they groom the next generation of storytellers. An experienced doctor.
Okay, good morning, everybody.
Good morning,
it's a pleasure. Thank you. It's a great pleasure to be here with you all. Mrs. Nike Abagon, the convener and founder of Quiver Ministries. Thank you for inviting me to speak at a forum like this that I think is so important, and I think people need to realize that they are not alone. They're not walking this journey alone, and that there are people who have walked the journey before them and have successfully walked it. You've heard my profile, and I just want to talk briefly about the amazing parents that I had. My mother was late Dr. Mrs. Abimbola Silva, a medical doctor, one of the earliest medical doctors, female medical doctors in Nigeria, and in fact, the female doctor in medicine from Nigeria. My late father was Chief Emmanuel Alabi Silva, late as well. He was the Otulisa and then the Bobajiro of Lagos before he died. He was a lawyer, and he worked right throughout with the US till he retired. So those are my parents. Like I said, they're both lived. The fertility challenges that they had was that my mother had very, very heart-wrenching several miscarriages. And she had those miscarriages by the time that they could actually tell the sex of the child. And she lost, if I memory serves me right, 5 male children. By the time when her mother was died, and when her own mother died, she actually couldn't attend the funeral because she was in hospital, trying to preserve the pregnancy that she had at the time. And everybody said she shouldn't come to, the doctor said she couldn't go to the funeral. She had to stay on bed rest. She had to. So in other words, what I'm trying to share is the fact that she did everything that was medically possible to preserve the pregnancy, but unfortunately she lost it. And at the end of the day, she had to have a hysterectomy. But she had the hysterectomy after I had come along. I don't know when they decided that they were going to adopt, but I was adopted in 1961. And I was what you would call in the adoption parlance a foundling. I was a baby that had been found, well dressed according to the form that I saw. They said well dressed, obvious, and there's this sentence, obviously well looked after. And but they found me, and I was I was found by the Red Cross. I had been found and taken to the Red Cross, and I was adopted from the Red Cross. And this was in 1961. I will be 60 this year. I have been a performing artist since 1981, so I would have been performing for the past 40 years. And my experience as what you would call an adoptee is something that I keep wondering, really, what is there, that I really didn't see any difference between my own upbringing and the upbringing of my friends. I was loved. I was incredibly cherished. And so that, and then my parents, they were also incredibly strict. My mom and dad were incredibly, there were just some things that were not allowed. So for me, sometimes I feel that the people who actually do need to, who probably may need to be spoken, to have a conversation are probably adoptees, not adopted parents. Why do I say adopt or parents who want to adopt? Why do I say that? Because adoption is an option. It's an option that it is an available option. From what we've heard from what the doctors have said. An option is through IVF, an option is through surrogacy, an option is through adoption. There's some people who adopt babies, there's some people who adopt grown-up children. They don't particularly want to go through all that changing nappies, so they adopt grown-up children. So the choice, I guess, is what I want to say, to adopt is, do I want to share my love? Do I want to express my love through this other human being who did not come from my stomach, but is a child of my heart. You know, so that's the way I kind of see it. Adoption, it's a choice. It's a choice. It's a choice. Do you want to share? Do you want to, or do you want to go through another method? Yes, I discovered about my adoption, pretty. I think because it was something that my parents never told me about, so I discovered it myself, and it discovered me myself, and then somebody else said something outside, and by the time and then I discussed it with my mom, and I could see that it was not something she was comfortable sharing, so I left it alone. So and that's really another conversation totally. This do you tell or do you not tell? And that's a conversation that parents need to have with their children. When they are ready, some parents can't handle it, some can. Some can. Some parents can handle it, some can't. So but I do know that I had the most amazing parents. My parents were incredible. They showered me with love all throughout my life. I mean, they showered me with love all throughout their life. They asked on now. My position in the family is that of number 2. I'm the bearer of the family, and my entire family recognize me as the bearer. I think some of the challenges that people have is that how will the family accept this child? Will the family treat this child? And I think the way the family treats your child, it depends on how the family treat you really, or their own perception of you, or their own feelings towards you, their own emotions towards you, in the sense that if your family love you, they will love your child. Whether it's a child from your stomach or the child from your heart. Do you understand? So so for those who are worried about the stigmatization, it was the stigma. As when you raise your child in a way that child will never, and they brought me up in such a way that all my life I always remember whose child I am, as we say in Yoruba. I remember whose child I am, so there are some things that I know must never be associated with that name. Do you understand? So for me, that's those are the thing. I know also. Yes, there's also the issue where people are like, okay, how do I know that this child that I am getting is not the child of a mad person? My response to that is that when we look at the issue of mental illness, part of it, from what I understand, can be genetic, but some of it, there's quite a lot of mental illness that is not genetic. What if the child that I have or that I adopt has a congenital issue? What if the child that comes from your stomach has a congenital issue? Do you understand? Those are always the things that your child is your child is your child, whether from your stomach or from your heart. And there will be people who will love that child because they love you. And there will be people who do not like that child because they do not like you. So it's so like I mentioned earlier, it is an option. It is an option, and if it is an option adoption that you want to take, Lagos State in particular has very, very good the process for adoption in Lagos State is really, really good and very, very modern. So I would visit them at the family. I can't remember the name now. Ministry of Social Services. I know that's where the adoption ministry is. So like that's all I want to. That's all that I can say right now. I think I was a bit more fluent in the video that I did, but I do hope that in what I have shared now, it's been let's put it's been comforting for those who are looking at that as an option. God is the giver of all children. He's the giver, and He adopted us into His own family. And so, if adoption is the option that you want to take, you are taking an option that God Himself took. Thank you so much.
Thank you so much, Ma. That was a very, very beautiful, beautiful story. I've always shared every time. I tell everybody that I wish my parents adopted because I'm an only child. I want to have siblings to fight with, but they did not adopt. So I'm fighting with myself. Nobody to share clothes with, nobody to fight me for shoes and everything. But I love your story, and it's a story I share every time I'm speaking on this thing because I feel that we need to have more people speaking up concerning the beauty of adoption, of showing love. It's a gift, So thank you so much for sharing your story. It was a blessing, and of course, thanks for being you. God bless you so much. We appreciate it. There are many questions for you, Ma. I'll go into the questions, but I want to just So I want to just, we'll take all the questions together, but your series of questions are very, very long. And I think it is important people want to know about, you've shared some of them already, you've addressed some of them, but people still want to know more, especially concerning how you would have felt your parents were feeling, because sometimes we just make assumptions. You personally just felt like from your, let me not ask the questions yet. After all the speakers will have the question and answer session, I'm just excited to hear your story once again.
No problem. I'm here to answer
Ma.
the questions. No problem at all.
Okay, so I'd like to bring in our next speaker. This is someone I really, really care deeply about. I love and respect, I admire. Pastor Ituah Ighodalo is the founder and senior pastor of Trinity House Church. He is also a fellow of both the Institute of Chartered Accountants of Nigeria. As former managing partner, Ighodalo and Co., Pastor Ighodalo brings to the firm 20 years of experience in auditing, accounting, taxation, human resources, and financial advisory services. He is also the editor-in-chief of the Christian News and the Timeless newspaper, as well as the Timeless Business and Leadership Quarterly. Please, let's give a Zoom round of applause for Pastor Ituah Ighodalo. It's good to have you here, sir. Good morning, Pastor Ituah. You have the floor, sir.
Good morning. How are you? God bless you.
Thank you, sir.
Well, I was talking about the various spiritual ways by which people can have children. Of course, the first is the natural, but everybody will know that children are a heritage of the Lord. They're a gift from God. From time to time, God gives children, and from time to time, God withdraws or withholds, either temporarily, most of the time, that gift. Okay. The Bible says that Sarai was barren, and she was barren for almost 80 years. 70 years. She had her first and only child at the age of 90, and there was a reason for it. Similarly, Anna was also barren, maybe for at least 10 years or a little bit more. and then finally gave birth to Samuel. There was a reason for it. Also, the wife of Isaac, Rebecca, was barren for about 20 years. Okay, so she probably started giving birth at the age of 38. If we assume that she got married when she was about 18, Isaac on his own part was 60 years old when he was able to carry his set of twins, and that's all that she had, and so on and so forth. Also, Rachel, Joseph, Jacob's second wife, was also barren for about 7 years, 7 to 8 years. She was believing God for children until finally Joseph came. So typically, when there's primary or secondary infertility, there is a reason why God is doing it. Similarly, Elizabeth and Zachariah were also childless for many, many years. Childless not because they couldn't have children, but childless because God delayed their childbirth and he had a plan. And finally, John the Baptist came. The parents of Samson had a similar problem. And what makes me very excited is that where there's these sorts of delays and these sorts of trauma, it is typically because wants to do something really, really exciting and something truly outstanding with those children that he has caused a delay of conception for. So that's a blessing in disguise when there's those delays. And people who are waiting should know that the only person that was barren in the Bible was a lady, the wife of David, who was barren because she displeased both her husband and God, did not like or appreciate her husband, but reckless, and so on and so forth. So we need to look at all these things and understand that God is in the business of making things happen. Now, does God support things like IVF, in vitro fertilization? I would like to think so. What people do not realize is that the science that we discover by doctors, medical people, scientists, mathematicians, physicists, and so on and so forth is just people discovering some of the laws of God as revealed by God. And a lot of these things come simply by revelation, by revelation, by revelation. A lot of people who have great ideas will tell you that they really don't know where that idea came from, but they were just inspired by something. And that something is usually the Almighty. This doctor that wrote Healing Hands, this very famous doctor in America, turned to be a politician eventually, said that a lot of the time when he needed to perform an operation, was a fantastic pediatric surgeon. He would first of all go to God in prayer, ask God for direction, ask God to move his hands, and then he'll find God doing amazing things with himself, with him. Even the doctors say that we administer, we try, but only God truly heals. Sometimes they say, well, we've done our best, it's up to the man up there. And this is typically how life is. So science, a lot of Christians sometimes inadvertently tend to fight and challenge science and believe that faith is that God must just do things automatically. But then, apart from faith, God gives you wisdom. And wisdom is science, is knowledge, is intelligence. And sometimes when God has provided wisdom, he therefore doesn't need to do a miracle in addition. Even some of Jesus's miracles were done with a bit of medication. Okay, so he put dust on the eyes of the blind man and told him to go and wash in the pool Siloam. It was some kind of medical experiment that if we interrogate further, we'll see the medication thereof, almost like vaccination. Let me introduce to you some of the elements that produced your eyes in the first place, and maybe they can correct the glaucoma or the cataract that was in the eyes after you have washed. Maybe the grating of the gravel will remove the cataract, and then you can see. So Jesus did a lot of his things through a lot of knowledge. And a lot of the laws, the health laws, the hygiene laws of the Jews in the first place given by Moses were laws of hygiene, laws of health. Somebody has a little boil on his forehead, watch that boil. Let's see if it's a leprous boil. If it's a leprous boil, like we do for COVID-19, isolate the guy for at least 7 days, almost the same thing with COVID-19. Let's see what happens to that boil. And if he doesn't break out in a rash, then it means that it was just a boil and not a virus. And therefore, you can bring him back into the tent. If it's a virus, isolate him, let him wash in the water in Jordan, let him be clean, let the virus take its course. And after a while, he'll be healed, although he may not be made whole. After a while, he'll be healed, he may not be made whole. So these are scientific laws that over time, there's been more revelation and people have been able to address them. The problem we're having with COVID is that the full revelation concerning how to handle it has not happened. There was a time when malaria was a dangerous illness. They didn't even know what caused it. They didn't know that it was a tiny mosquito, and so on and so forth. There was a time when Spanish flu was a big problem, typhoid, a big problem. Even HIV was a major problem many years ago. But today, there are many, many people living a reasonably normal life, even with HIV, using their retrovirals and things like that. So this is what it is. So IVF, God has full support of IVF. How do I know that? Even Adam was an IVF baby in the first place. Adam was an IVF baby in the first place. The Bible says that God made clay, he breathed into clay, created the baby outside of the clay, breathed into the clay, and the clay became a living being. So it's the first form of artificial insemination that God did. Jesus Christ was virtually like an IVF baby also. The Holy Ghost will fall upon you. The power of the Almighty will overshadow you, and suddenly something will be planted in you, and that thing will be called the Son of God. So these are the examples that we have all over the place of IVF. So all God does with IVF is to extract the science that goes on inside the womb and specify it in a test tube and then replant inside the womb. They even do it in vegetation, in gardening, in agriculture, and things like that. So there's nothing wrong with looking for scientific methods of having children. Was a surrogate baby, okay, given birth to by his mother as a surrogate for the daughter of Pharaoh. So these things have been going on for a long time. Even Ishmael was a surrogate baby, given birth by his mother, okay, and for the wife of of Abraham. What about at least four of the sons of Jacob were also surrogates given birth to by Zilpha, the slave woman of Leah, and Bilhah, the slave woman of Rachel. Okay, so surrogacy in terms of having other people carry babies for you, and then you then accept that baby as your own, either carrying in your womb or them carrying in their womb or using your eggs and all that. All those things have happened. Even the great-great-grandfather of David, a gentleman called Obed, who gave birth to Jesse, and Jesse gave birth to David, was also a surrogate baby, given birth to by Boaz and Ruth on behalf of Ahimelech, their grandfather, the husband of Naomi. And therefore, that lineage of Naomi and her husband Ahimelech was continued through Ruth. Okay, since Shalom and Chilon, her two children, her two sons had died. So the kingsman redeemer who is like our Lord Jesus Christ, Boaz, made sure that he did that surrogacy for them. So we've had all these sort of issues in the Bible. As a matter of fact, the only time that God killed a man, Er, the son of Judah, or his brother, I beg your pardon, was because he refused to be a surrogate for his older brother Er. That's Onan. He killed Onan because he refused to be a surrogate for Er, because Er had died, and God got angry and said that's bad behavior. So this is where we are, and therefore nobody should be embarrassed or feel that God has failed them if they have to use other issues to have their own children. The important thing is who cares for the child, who takes responsibility for the child. That is the parent of the child. What about adoption? Many cases of adoption, even in the scripture. Okay, like I said, Moses was first of all surrogated and then adopted by the daughter of Pharaoh. She found him in the water and decided to adopt him and give him his name, Moses, drawn out of water. And that's the name that he's known by, because she adopted him and became the mother thereof. So these are the different kinds of stories that we find in the Bible and we take hold of and we use to support our faith. So God is a dynamic God. God is the one who sees the beginning from the end. God is the one who knows exactly what he's doing.
So we apologize for the break in transmission. I think Pastor has a bit of issue with the network. I guess Pastor has spoken a lot.
Okay. Buki says sometimes people don't share those testimonies as means to self-protect and save themselves and their adopted child from being stigmatized. Our society is full of labels and stigma. And then somebody replied to her who says, sincerely at Buki, some with loose mouth can abuse and call the child names because they know the adoption story. I'm trying to get another one. Another person, Kingsley says, men are the biggest bane to adoption because there is nothing any woman can do if her husband doesn't welcome the idea of adoption. I am an adopted dad with other biological kids too, but the decision to adopt was mine and my wife bought into it. So we need to get men to see adoption as not an option, but a godly option towards being a dad. Seen in the sight of God, the real father is a person who works with God to bring to pass his counsel and plan concerning the child. Should I continue reading the comments now, or are we ready with the video?
Yes, please, go ahead.
All right. Okay, so there are questions. I'll take the questions when we're ready to do question and answer session. But let me just quickly read this comment. One was appreciating Auntie Jackie Silva for sharing her story. Another person, William, says this is so enlightening and inspiring. Kingsley Obum says, once you adopt a child, the history of the child becomes insignificant as he or she becomes more and more like the adoptive parents. A child from a mentally disturbed home or dad assumes the nature of the adoptive parents through love and impactation. Love is more powerful than genes in adoption. I'm having more questions for the doctors here. Okay, so I think Pastor will be the most appropriate person to answer this question. Even the writer acknowledged, Pastor Ituah, this question is for you, sir. The writer says, my question is a bit controversial, but becoming an issue for conversation among Christians. Single ladies are beginning to consider IVF and other fertility options when marriage isn't common. Is this an option for a Christian lady to take? Wow. Okay.
That's a very good question. And the reason why is that it will be difficult to prove their chastity if they have but I think that if they can engage their pastor, they can carry their family along and their immediate circle of friends. I don't think there's anything wrong with it, to be honest. There's nothing wrong with being a single parent. if you don't have the opportunity to get married, there's nothing wrong with that. The easier one being, and that way it is very, very clear. You don't have to make too many explanations. But you can also explain that this is the IVF you decided to do and move on with your life. I don't think that God would be angry with you if you decided to have children through artificial insemination. What He does not want is sex outside of marriage, which can lead to a lot of problems, challenges, issues, spiritual problems, and so on and so forth. So that would be my short answer on that. But my counseling preference for those ladies will be simply for them to, first of all, try adoption as a simple way forward in that process.
Thank you for giving both the personal. There's a question for you. I think you've addressed it a bit, but let me just still read it. It said, being a pastor, how did you feel or accept the adoption idea? And let me just lump it up with, what was your family's view and how did you manage the family, both yours and your wife's?
Well, thankfully, I'm very enlightened. And honestly, I am my own man. And my wife is her own woman. We're both our own people. We take our decisions. We don't need to seek anybody's counsel, anybody's permission to take our decisions. They may weigh in and make their own suggestions or ideas, but we're our own people. I thought and I felt that it was the right way to go, and I felt that it was a blessing. And I wanted to do everything to encourage my wife and to satisfy her. And we went ahead. It wasn't even, in fact, the first adoption was a spur of the moment decision. We hadn't actually thought too deeply about it, but she got the idea. She said this is what she wanted, and I said, go ahead. And God gave us a wonderful baby girl, and so on and so forth. The second one also was similar. I didn't need anybody's permission, and once I did it, and I told my immediate family, just my brother and my sister, they were all for it. In fact, they were excited and they were happy, and so on and so forth. And we moved on with our lives. We have two wonderful children that I'm very proud of, and I'm thankful. It's almost the best thing that has happened to me, as far as I'm concerned. Honestly, my children are perhaps the best thing that has happened to me. In fact, if I could choose, this is probably the way I would have chosen to do this business and move on with my life. You know, it's just that sometimes you are young, you are impressionable, society box your head and all that. But if I could choose this, I think I've done the right thing. I have no regrets. I have no feeling of anything. I'm very, very happy. And my wife was extremely happy before she passed. So we truly, truly thank God for the privilege of what we went through. And of course, because of what we went through, my wife runs a foundation called Ighodalo Foundation, whose job is just to make it possible for people to have their own children, either through counseling in marriage to ensure that they have their children naturally, or through the IVF that we're very well known for. We have the 40 by 40 program going on right now that we have concluded. 40 couples who are now going through the process of IVF because we're able to, God was able through us to provide the resource. And then finally through adoption, one way or the other. My wife used to say, "Magwete mijo, temini cholomba fuen." It is what God gives you that is yours. So that is that is what came out of that journey, and it has been a blessing to a lot of people. So net, looking at it from every perspective, I think God wins, and we win, and the people win. So God is a fantastic God who sees the end from the beginning and the beginning from the end. if you can bear the pain and try to see from God's perspective, don't unnecessary for what is very temporary. It's just a temporary situation and usually part of God's plan. If Joseph had known that the pit was going to take him to prison, he wouldn't have wasted his tears. He would have just had a good time. Take him to the palace. They have just had a good time in the pit and just be worshiping God and thanking God. That, what a privilege to be in a pit. If he knew that that was his way to the palace. But he didn't know. He didn't know. He didn't see what God was showing him. And cried and cried and cried and cried and cried. He wasted his tears. He could have saved those tears for something else. So this is the way I look at things. And in all things, we give God.
Okay, sir. I want to ask a question concerning surrogacy. The challenge between surrogacy and adoption. Some people feel that being a surrogate, having a surrogate, you're putting your baby in another person's womb. It's so artificial. It's not spiritual. It's not godly. Some feel like the person that is your surrogate might take ownership of the baby or might have an attachment to your baby. And some would just say, rather than surrogate, let me do adoption. So, sir, I want to ask you what your opinion is concerning surrogacy. Do you believe that people should pursue surrogacy rather than adoption? Or if you were to pick one or advice, which would you say people should go for,
Like I
adoption
said,
or surrogacy?
well, it depends on what's available. You know, sometimes they are looking to adopt a baby and the baby is not available. You know, it's not that easy to also find babies that are available for adoption. So if you can make a surrogacy arrangement and the person you are dealing with is willing to surrogate and be surrogate parent for you, there's absolutely nothing wrong with it. They agree to do this surrogacy for you. If in between they change their mind because they are now attached to the baby, then so be it. You know, you keep trying until you get the one that falls in place. Maybe, I don't know if it's expensive or not, blah, blah, blah. But you just keep trying. Everything in life has a risk, okay? Even the baby you give birth to naturally, first of all, you don't even know what sex they're going to be. That's a risk. You don't even know how they're going to turn out. That's a risk. And you don't know whether they're going to be healthy babies or not. That's a risk. And even if they're healthy babies, you don't know what they're going to be. If you wake up step out of your house, it's risk. You don't know if you're going to come back home. You just have to keep doing what you think you should do and do it. So if you have somebody ready to do surrogacy with you, please, by all means, go for it. Go for it. As long as you don't steal that child or kidnap a child and do something illegal and painful to a third party, I think any means by which God is perfectly in order.
Well, Pastor, I hope you know that this opinion is not very. We have a few questions. I'm trying to read from Zoom and read the ones that were sent in before. So there's one question that I think, I'm not sure whether you answered the question or not, but I know that many people are curious about that thing happening with adopted children. Ansioke, did you ever consider looking for your biological mother or your biological parents? Did you try looking for them?
Well, no, I didn't because I didn't know that you could. You know, I believe, I think part of the challenge for parents who adopt, like you rightly said, is that will the child look? Now, I know that in England they have, or in the West, they have open adoption where the child can, can have, when they look in their file, they can then go search for the parents. But in Nigeria, I don't think we run such a system. That's number one. I think a lot of the adoption that we run in Nigeria is closed because once the investigation has been done, that the parents are not going to come looking for the child again, or somebody is going to come looking for this child, then the file is closed and that's it. Now, will the child think, when the child knows that they are adopted, will that child think about the birth parents? I honestly think that that's natural. You will think about the birth parents, just wonder who they are. But at the same time, the real parents that you have are the parents that brought you up. Those are your real parents. Those are, do you understand? So I think the confusion tends to, when for adoptive parents, is that will they be seen as the real parents? But so it's so there's the birth parent and there's the real parents, and the real parents are the ones who brought up the child. I hope that answers your question.
Yes, it does. It does. I wanted to ask. I wanted to ask the question about how did you explain to your husband, because sometimes people wonder how did you explain to your husband that your parents are your parents but not biologically, and how did you explain to your children? Obviously they would have heard the story several times by now, but what was the initial response of your husband and your children?
Because I'll tell you how my own came about. Because I had a relationship earlier with someone else that I was dating, who had mentioned that the mother was a bit concerned about him having a relationship with me because I was an adopted child. I took it from then on. I had decided that whoever I date, if the relationship is getting serious, it's not the first thing I discuss, but if the relationship is getting serious, okay, before we move any further here, this is who I am. So are we going ahead? So there were two issues really with me and in my dating. It was my career as an actress and the fact that I was adopted. So if you were not prepared to accept those two things, I was not prepared to go ahead with the relationship. So with my husband, I just said it, and he was like, "Oh, okay, I knew," So it was just that it wasn't for him. It was not an issue. And wow. I remember when I now finally brought him home to meet my parents, it was one of my mother's concerns, that does this gorgeous man know, So I don't know how the conversation kind of segued in that direction. I can't remember. I really can't remember clearly anymore. But you could see, I mean, my mother just warmed up to him, and I mean, he could never do any wrong after that.
Oh, that's it.
Yes,
we thank God for such beautiful stories.
Anyway. Yeah.
If I can speak to that, Joker, if you don't mind,
no
in
problem.
that we really need to get the stigma or the stigmatization out of adoption. There's nothing wrong in being an adopted child. You are neither a leper, nor a failure, nor a mad person. You are just a child, as any other child that was looked after by, because somebody is not your biological parent doesn't mean they're not your parent. So there's nothing wrong. It's not, there's nothing wrong. And it's also not your fault. So people really should really get that stigma out of their minds and know that a child is a child is a child. Okay. And anything can happen to anyone. I don't know why people find it so difficult to get it out of their minds. And we need to speak a bit better to this issue. You are a human being with your own senses and your capabilities and your own abilities before you are anything else. So let's relate to all as human beings, and forget about all this and all that. You're not a thief. You're not a criminal. And even if you're a
Yeah.
thief, you can be forgiven for stealing. You know, so we need to be more human
I
in
love that.
our attitude to life. Thank you. That's all I just wanted to add to that.
Yeah.
Okay, thank you so much, sir. Oh, there was all this. I'm also in between two events. So I have my assistant here. Her name is Ademi. She's going to be taking other questions for the doctors. She'll be asking the doctors questions. But Pastor, I just have to ask you this question. I've read it twice on two different platforms. One was even sent on our show, Your View on TVC. An adoptive child that is a boy, and then the parents now finally had biological children years after, and the man claims to be in love with his children, and then they say some cultures is okay that, well, it wasn't legally adopted, but you know that sense of, so it's not your child anyway, and how, what's the relationship that can happen, what's the extent of relationship that can happen between an adopted child and the parents that now have biological children after? How do they relate? How do we raise such children together?
They have to raise them together as brothers and sisters
Yeah.
because they're all their children. You cannot, because you adopted a child and then you have your biological children, then discriminate in your own house. It's not possible. You just continue what you are doing and set the rules in the house and give everybody the same opportunity and the same chance. Law is a decision, not an intuition. And this is what they must do and continue. So it's the parents that have that responsibility to make sure that there's really no difference. You shouldn't love a child more simply because they came out physically from you. I don't think that is acceptable. So it is the parents that must take that decision and move on with their lives. Thank you.
Okay, thank you so much. Thank you so much, sir.
Sorry, the video, we're having a lot of issue with the video. I just want to speak to the video briefly before we go to continue the question and answer. Basically, the video showed pictures of Lady Bidun at all the event and, work she's done in this area. Quiver will celebrate her. We also want to ensure that we join hands with her to continue to see Ibiduni Foundation succeed as well. My pastor, I know that she had, just before she passed, she had this 40 at 40 initiative. Even though we are also like still struggling to raise money for all of the things we want to do, but my pastor taught me something. When your harvest is not enough, turn it to a seed. And so based on that, we would like to donate to that vision. We will get in touch with Pastor after this event. I want to truly appreciate Pastor Ituah Ighodalo for his time. Thank you so much, sir. Thank you for being such an inspiration. Thank you. We love you. We appreciate you. We pray that God will comfort you in the name of Jesus. Thank you very much. Tokwe, over to you. We can continue with the question and answer now. Pastor, I'm going to send you.
Thank you very much. Thank you.
Okay, thank you so very much, sir. Thank you so very much, sir. Okay, so we will continue with the questions and answers. So this one says, to doctors in the house, what's the best option for a woman that has had blood clots in the past and is still waiting for the fruit of the womb? IVF for surrogacy. This is from Toyin Oluwayimika to the doctors in the house.
Can I answer that?
Okay, please, do you want me to take the question again?
No, I have the question. I'm just asking that.
Okay.
Do you want me to answer it?
It's okay. It's okay, sir. It's okay,
Well,
sir.
I think the question is incomplete because she said blood clots. Blood clots where?
Yes.
Blood clots doesn't mean, she needs to be a bit more informative
Elaborate.
about what kind of blood clots and where was it.